So, working in the correction facility, it seems that you guys, since the Oregon State Hospital has been, funding has been cut dramatically, there's a lot of the mentally ill, I guess we could say, on the streets, and they get involved in, unfortunately, criminal activity. It seems like the police are kind of mandating that. And you said if you have to restrain a psychiatric patient, what kind of was your protocol if you figured they had psychiatric problems? Did you just immediately restrain them because of that, or
no?
How did you handle them in the general public?
The same way, or in the same way that we would, in hospital. We would try less restrictive means, offer treatment, offer various kinds of alternatives. It's better to find out what's going on with someone if you can, and allow them to, or assist them to get through whatever crisis they're experiencing, and marshal whatever coping skills they have, rather than resorting to a use of force of some kind.
So you keep them in the general public with all the other inmates?
That depends on how acutely ill someone is.
So there is somewhere for them to go if they're what you consider acutely ill?
There are, yeah, there are. There are different, there are different kinds of units, and some that even look and operate much like a psychiatric unit or a hospital unit, only they're just in a different institutional setting. Not as well staffed. There's always the situation that treatment and rehabilitation and stabilizing illnesses really is the primary mission of the criminal justice system. So, and that's probably one of the hardest things to get used to. Being a person with a treatment background or a clinical background, and a health education, to go and work in a correctional or a law enforcement sort of environment. There's a different set of priorities and a different mission, essentially. But there are also at least as many, if not more, civil rights kinds of issues.
Do you feel like patients are more likely to be abused in 4-point restraints in the criminal justice system?
I don't think that, I don't think the use of restraints for psychiatric illnesses is probably any greater in the criminal justice system than it is in an acute unit. So it isn't really any more, it isn't any more likely. In point of fact, there are, the protocols and policies and procedures in both hospitals and correctional environments are such that there's a lot higher level of observation that's required, and all of the criteria for trying less restrictive methods and alternatives are still there. But I think that the capacity to provide good medical and psychiatric care inside of another institutional setting is less.
Is there anything you think that we haven't covered that you would like to let the general public, that you would prefer to have the general public know? regarding 4-point restraints?
I can't think of anything. You know, I think that in all the time that I've worked in mental health settings, I think that secluding and restraining people is probably one of my least favorite activities.
Do you think we could ever get rid of restraints, physical restraints?
I think that the use of restraints over time has diminished, and probably for a number of reasons. A higher skill level among the staff, the development of more effective medications and treatments have helped. I would hope that we've gained some knowledge and became somewhat more enlightened over time, and we do have other alternatives than to just restrain people.
Okay, I think that's it. Thank you very much for all your